My name is Mehdi Shajari. I'm a refractive and lens surgeon based in Frankfurt, Germany. So, how does Chronos fit into my clinic? Basically, we are a center for refractive and lens surgery. And what this means is like we are really depending on the results of the subjective refraction. I have to do a lot of subjective refractions due to this. And the Chronos is, of course, of a huge support in that matter. What we do is before surgery, we use Chronos, but more importantly for me, is after the surgery to know, like for example, after the first eye, what was the result and not just rely on an autorefractor. We use the Chronos to get like a subjective feedback from our patients and get then an adjustment for the second lens for the second eye. So at our clinic, most of the time the optician is using the Chronos system, but sometimes also in Germany we have got something which is called MFA, so it's like a medical assistant who are not trained into optometry, but still with the Chronos system are able to give us a subjective refraction of the patient. So these are the two type of people who are most of the time using Chronos. I have to say I myself do it very rarely. So basically in our clinic the workflow is like that. First step, the patient goes to our optician and they will get the clinical history. After getting the clinical history, they do an autorefractor and then we go on and do actually the whole measurements, like for example the OCT, the Scheimpflug imaging, and so on. And afterwards, the patient is once again seen by our optician and the subjective refraction is done. And this is the moment when we also use the Chronos system. After that, the patient is introduced to me. This is all the case before, if the patient didn't get surgery so far, so it's before surgery. If it's a patient after surgery, it's a bit faster, so then it goes directly to the optician. They do the Chronos system, they make basically the refractive measurements, and then the patient is introduced to me and I decide whether we need further examinations with other devices or not. Actually, I think most of the most of the patients enjoy the process because for them it's also something which looks to a certain degree a little bit sci-fi, I want to say, yeah, like most of the devices which we use in ophthalmology. So I think for them it's a little bit of adventure park when they go to an ophthalmologist, and the Chronos system has got also like an excitement in that matter to this situation. And I get really positive feedback. I mean, there is not the patient who comes to me and says like, oh, I'm so happy we did the refractive system now, this time with the autorefractor. But they just enjoy the process. It's very streamlined. It's very easy to understand for the patients. And I think it's just like a clear communication from the device to the patient, which makes it easy for them to understand and progress. I think the big benefit of the device is that it has a clear communications to our patients. It's like they know what they have to do, they know how to respond, and this makes it very easy for them to basically get a fast but still reliable refractive result. So, how Chronos is helping me in our clinical workflow? There is 2 points which I would like to emphasize here. The one thing which is really a pain for any kind of refractive surgeon who is placing in a lot of trifocal lenses or multifocal lenses in that matter, we cannot rely on autorefraction because we know the optics of the lens are complex and they cannot be basically measured by an autorefractor. Giving all the time this task to measure the patients after the surgery to an optician would be very time consuming, and this would basically restrict the number of patients which we can see after surgery. And this is where Chronos is, I think, of huge support because we can now get a reliable result after surgery by using, in a way, an automated system. And also using the system for cases which couldn't be measured before as we said, with trifocal or multifocal lenses. So I think this gives us a lot of liberty and a lot of time saving, and is a great support for me and my colleagues. The second point, which I think is also very beneficial, we know in what times we are currently. We know how difficult it is to get also trained staff. And very often one person is sick, for example, or another person has got maybe is on vacation or something like this, or an emergency evolves. And if you don't have got your optician at that place, it means you as a doctor has to do all these examinations. And this is, of course, one of the most time-consuming examinations overall. And for this, if your staff is trained, if you are supporting medical staff, in our case, as I said, we call them MFA, so medical assistants. If they are trained with the Chronos system, I get very reliable results similar to actually what an optician would do. It's not the same, but it's on a level which is sufficient to keep your business running. And so I think these are the two big advantages of the Chronos system. Okay, so how reliable are the results which we get with the Chronos? We did a study at our own clinic and looked at the results of an experienced optician who did the subjective refraction all the time. And we compared this actually to two people. So it was one time where the experienced optician did in a randomized manner the measurement with the Chronos system. But I wanted to know myself, when an assistant, a medical assistant would do it, how the results would be. We didn't publish that part, but nevertheless, I would like to share this information with you. So what we found out was that the numbers which in our cohort were measured, they were actually non-significant in the difference. So it means that the Chronos system is quite reliable as we compared them to an experienced optician. On the other hand, what was also very interesting to me, also a person, our medical assistant, who is not doing optics every day, we also there couldn't find a significant difference when they were measuring as compared to our optician, the subjective refraction. So if I have to use two words to describe the Chronos system, I think I have to use four words, to be honest. The one thing is, I would say it's a safety net for me, because there are often times when, as I said, like for example, one of our employees is missing. So here, Chronos can help us to keep the workflow going on. And the other word which I would like to describe, the other two words which I would like to describe the Chronos system with is it's a true time saver. It helps us basically to get to reliable results with subjective refraction much faster and in a much better way than we have been ever before.